This may be the most advanced in the world, the most expensive and complex medical device. Running costs $40,000 per minute, and the cost of importing a piece of equipment is as high as $750 million. This is the ceiling gardenia knife of radiotherapy. So what does he have? First of all, don't think he's the size of a room. In fact, behind it, it's an enormous object covering thousands of square meters. The components of the entire device include a proton source, accelerator, digital flow delivery system, and treatment bed. First of all, proton sources are the starting point for proton therapy. Separation of positively charged protons by ionization economy. After the proton is generated from the proton source, it needs to be accelerated to a very high speed by a proton accelerator. High energy. The proton accelerator. Usually there are cyclotrons and synchrotron. Cyclotrons are relatively small. It's a power plant that uses a constant magnetic field and vibrations. Gradually accelerate protons along the helical path. And the synchrotron is to use synchronized magnetic fields and power plants. Accelerate the fixed circular orbit of the proton rock. The final quality. Subvelocities approaching the speed of light. Immediately after, the accelerated proton number enters the digital stream transport system. He uses a strong magnetic field. Bend or focus the number of protons along a predetermined path. Then through a 3-story building, 45-ton rotary rack released. Make sure the final proton number is accurate in 3 dimensions. And pinpoint the tumor. And when protons first start to penetrate human tissue, it releases less energy. After reaching the tumor site, it will quickly release a large amount of energy to kill cancer cells. This phenomenon is known as the Bragg-Wind effect. Mind you, that's the advantage of proton therapy. Conventional X-ray radiotherapy, when it penetrates the body, the energy will be gradually released along the way. Leads on the path into the human body, and beyond the tumor, to health. The tissue causes unnecessary radiation damage, have side effects, and proton therapy can take advantage of the Bragg peak effect by precisely adjusting the energy of the proton number. After reaching the depth of the tumor, quickly stop and release energy, avoiding damage to the tissue behind the tumor. And the accuracy is very high, up to sub-millimeter level. Utilizing advanced proportional scanning technology, scan the tumor area layer by layer, precisely tuning the energy of proton surgery. Precision destruction of tumor cells. However, not everyone can afford it. Due to its construction and maintenance, the cost is too high. The first is the accelerator. It's very expensive to make. It is the supporting treatment center. It is often necessary to provide a huge space for equipment operation. And in order to ensure the precision of the equipment, the building had to be stable. The ground machine is 58 meters deep. And to prevent the proton force from escaping, it also needs to have a thick radiation flat arm wall. It's 4 or 5 meters thick. And the wall, not even a hair thick crack. The cost is much higher than seeing the entire hospital. And that's just the cost of construction. Upfront R&D costs. And the later operating costs are also terribly high. Because of this global total, there are only about 120 proton therapy centers in operation. And our country will not exceed the time.